All right, guys, Anthony back. I wanted to do something a little bit different, so I set up my camera to quickly, or as quickly as I can, go over this bird flu summit syllabus that I printed offline from their website. It's 10 pages, cover page, back page, so about 8 pages in writing on the events that are going to take place. So I went through it, I read through it, I highlighted some things, and we'll thumb through it so you guys can see it. I'll also put a link so you could print it out for yourself because, my question is what happens after the meetings that take place October 2nd through the 4th? How soon after those meetings are these uh, scenarios, the possibility of these scenarios taking place? And so on some of them I put question marks, and you might be doing the same thing. But basically, you could read here what it says. It welcomes people. It talks about the developments in avian influenza, highly virulent strain of bird flu affecting both cattle and humans. That's right here. So according to what I know right now, there's only been a few human cases and only one death, the guy in Mexico that had a lot of comorbidities. So I don't know, how that number is going to rise and when it's going to start rising. It talks about discussing preparedness, response strategies, future implications, and evolving situation, which is right here. This section here, mass fatality management planning, talks about, I have question marks on every one of them. Develop and maintain plans and procedures and programs and systems. Implement training, direct fatality management tactical operations. I don't know what those could be. Is it burying bodies immediately, burning them? Conduct morgue operations. I don't know. Will you be able to go visit a loved one at a wake, or will that body be, quickly incinerated if it has the bird flu? I don't know. These are questions that I'm asking, and hopefully you guys will ask as well. Then here it talks about in government, 50% absenteeism, successive waves of outbreaks. So how many outbreaks do they anticipate? Again, these are questions I'm asking and everyone should be asking. Continuity of government functions, and then again, the topics go up here: mass fatality management, things that concern me: surveillance and data management. Does that mean collecting of our information or enhanced monitoring of us? Delivery of vaccine and antiviral medication. The socio-economic impact on poultry and livestock industries. Will these industries be going by the wayside? Will they be collapsing? Will we be transitioning to something like lab-grown meat instead? Or government-owned farms that are free from bird flu? I don't know. Um, you know, I want people to start thinking and asking these questions now because it seems like these things are coming upon us pretty quickly. Command and control management, resource allocation, insurance coverage, talks about business insurance. Back in the bottom here, ensuring safe travel policies. So will I be able to travel where I want to go, whether it's car, bus, train, plane, etc., or would I have to be vaccinated for bird flu in order to do that? Again, remote work is discussed numerous times in the pages. I went ahead and numbered them here. We're on page 3, including the cover page. Again, it goes on to talk about these topics: emergency management, prioritizing antivirals and personal protective equipment. What will these antivirals be, and what will the personal protective equipment be required of us? Will we have to wear masks when we walk out our door in stores? How is this going to work? Is it going to be similar to COVID? Again, it talks about staffing issues, supply chain interruptions. Whenever I see supply chain interruptions, I quickly think about this here, handling panic, and they got it right below it. So if you can't get stuff you need at the store and it's not on the shelf, people start doing this, and then the authorities have to start doing this. That's something that we should be taking note of. Again, safeguarding for law enforcement, vaccine and essential goods delivery. So as the vaccines are being distributed, law enforcement will be assisting in that process, I guess. Managing surge in crime. These are the most, you know, important to me here that could affect all of us. Managing surge in crime during the pandemic. Is it going to be worse than the surge in crime now that's being allowed to take place in major cities across the country, where they have street signs up telling you can only take like $900 worth of stuff? Will the police be on scene or letting things happen? I don't think during this bird flu process that the police are going to be idle. I think they're going to be, bringing out the baseball bats, if you know what I'm talking about. Controlling social unrest. How will this be done? And public disorder, because certainly it's not being done now. Implementing isolation measures in correctional facilities. So will people be sent to isolation centers, or is this people already in jail at correctional facilities? Will they be, they're already isolated. I mean, will they be in separate rooms or trailers? I don't know what that means. I guess they'll discuss it at the meeting. Conducting at the bottom here, conducting mass vaccination efforts. My question is how? Enforcing quarantine measures effectively. How? Is it through your phone? Would it be something like that movie we saw after COVID, Songbird, where you had an app on your phone and it took your temperature and you had to report it in every day, and if your temperature was above a certain amount of degrees, they sent a little squad to your house, like a sanitation squad, to pick you up. Again, questions. Managing traffic and transportation. I don't know what that consists of. Okay, maintaining water and sanitation services. Big one. Is water going to be infected from the bird flu? Are they going to have to shut down our water systems? Is sanitation services going to be limited? If so, what do we do with our waste? Addressing telecommunication overloads. Again, will the phone systems be down? Will it be dropping off? Will we be on some type of electric grid pattern where the power goes out for several hours a day? Again, talks about call center items here, remote work policies, workplace planning. Again, ensuring antiviral distribution. Again, what are these antivirals? Are they shots, vaccines? Are they like amoxicillin, ciprofloxacin? Are they antibiotics? Are they new medicines we don't know about yet? Is it a form of like a remdesivir? Supply chain interruptions again. Staffing shortages over and over again. We see that. Workforce decrease. This is big. Global influenza surveillance networks. Advancements in avian influenza vaccine strategies. Antiviral medication distribution systems. Again, we're seeing that word, those antiviral word, being used throughout. Global surveillance networks for timely response. What will this look like, I put? What's a global surveillance network looking like? Is it something where you're tracked and traced? Do you download an app on your phone and you have to turn it on and be tracked wherever you go? Do you have to report this in? Will your phone do it automatically? I don't know, but it concerns me. Again, talking about partnerships and collaboration within law enforcement and government. Trying to go through this as fast as I can. You guys can slow it down and read it. The best thing for you to do is print it out. Again, up here, operational readiness and testing. Is it PCR type testing? Will we be distributed free tests and have to show a negative test every day to our employer, or when we go to a store. I don't know how that's going to look. Again, whenever I see science-based public health travel measures, I get a little nervous. Understanding the dynamics of avian flu transmission to humans, I didn't know it was that bad. So what are they not telling us right now? Integrating wildlife and environmental surveillance for early warning systems. Does that mean cattle, poultry, etc. will be tagged and tested on a regular basis? I don't know how that would be done. Is it something AI would help do? Clinical impacts on the healthcare system, crisis communications, again, up here. Counter mis and disinformation. That's a big one. So we got fact checking, guys. Fact checking and debunking. Who will be doing this? Is it a government agency? Is it screened people? Is it only one side of the equation like we got during the last pandemic, where therapeutics that were known to work, that cost pennies, were demoralized and demonized and talked down and not made available? Will that happen again? Just questions that I'm asking. Mitigating talks about financial risks amid currency volatility. Will there be some type of banking crisis with paper money? Again, supply chain, shipments, market access, insurance coverage for pandemic-related risks right here. Who should attend? It goes by veterinarians, policymakers, pharmacy people, non-governmental organizations. I put, are these the same NGOs bringing in and placing the migrants? Big question we should be asking. These NGOs are certainly not doing us any favors. Again, page 6. Limited spread of influenza through effective carcass management. This whole thing here on carcass management, I'm puzzled by. Is it, how are they going to, when they cull 1 million birds, how do they get rid of them? Do they burn them? Do they bury them? I don't know how that looks. Is how much of this carcass management affects our ability to get proteins like poultry and cattle and beef? Just questions I'm asking here. These are questions anyone would ask. Real-time tracking of avian influenza on military installations. So am I reading that wrong? Is it the military will be tracking people in real time, or will they be tracking the infection rate on bases of military personnel? I'm a little confused. I have a question on this right here. How much is the military going to be involved in tracking people if they are going to be used in that capacity? Strategic defense plans. This sounds like wartime scenario to me here. Collaboration with civil authorities and seamless response. What does that mean? Does that mean, trucks show up at your house and take you away if you tested positive? I don't know. Again, discussing here the strains in mammals, the different pathogenic avian influenzas. Some of these I never heard of. Maybe you've heard of these. There they are there. Wednesday, October 2nd, and Thursday, they're going to be talking about poster sessions, these things here. So I'm sure we're going to be seeing posters plastered all over the internet and stores and in your doctor's office, in your clinics, in your workplace, etc. In your schools, colleges. You can count on that. Poultry screening, standardized requirements for avian influenza testing protocols. Again, I don't know what that entails. Effective farming systems. Don't know what that is. Capacity building and training for enhanced avian influenza surveillance. Does that mean no more poultry? Transition to lab meat? I don't know. I get confused on some of these topics here, and concerned at the same time. Instantaneous, affordable, highly sensitive bird flu detection. So viral detection technologies. What's coming out? That are they going to be able to wave a wand over you to tell if you're infected? A light, an infrared light that lights up. Instantaneous detection. What is that? What would you be putting yourself at risk for by walking under something that's going to instantaneously detect if you're infected? Again, global policy, judiciary committee's role in political, judicial, and economic issues, socioeconomic impacts on the poultry industry, challenges and opportunities. You know, how many farmers are going to be going out of business? That's what I think that's talking about. Surveillance systems, again, training and early warning. These things are concerning to me. Developing vaccination strategies for avian flu prevention. Is this going to be like a yearly flu shot? Ensuring access to vaccines and treatment in resource-limited settings. Again, with the increase in our migrant population over the last 4 years, to the tune of 20 to 50 million people, what does that look like in areas where these people are living throughout the country? Questions we need to be asking. Identifying and responding to emerging threats. Okay. Strengthening collaborative efforts. This is the global scenario here. Practices and lessons learned. This concerns me right here. Global Rapid Response Plan and Pandemic Control. Coordinated efforts for effective outcomes. So this global response, does it entail a UN team, a WEF team, a CDC team, or all those three teams together and other teams added all in one? What does that look like? And what do they respond to, and what do they do? Do they close down areas of the country, cities, towns, relocate people to isolation centers? How is this going to look? Is what I'm trying to envision this, knowing from what we've been through the last 4 years. I'm trying to envision another round, round 2 of a 10-round fight. What does round 2 look like? Vaccination control measures. Again, bird flu risks to the public. Encourage appropriate preventive measures. Again, what are those preventive measures? Are they not eating meat nor drinking milk? Are they only getting government-approved items in the store? Is it lab meat? Are we going to be vegetarians? Do we have to, what does that look like? Global human and animal health. Again, monitoring, surveillance, and rapid response. Again, global collaboration. Whenever I see global collaboration, I get a little nervous. Again, this is the last page here. Again, I want to know what these antivirals are. What are the antivirals? Does anybody have early information on this? How come I don't see any topics in here, and I've been through this whole 10-page thing, and you've seen it too. I didn't see anything regarding a session on eating healthy foods, drinking clean water, breathing clean air, getting sunlight, getting your vitamins and minerals, taking supplements. Nothing like that. It's all therapeutics. It's all pharmaceutical produced items for the most part that I'm seeing here. Maybe I'm missing something. I don't know. Command and control and management, global in scale. Country's incident management system. Will incident management systems be integrated with other countries? I don't know. National and international surveillance. What does that look like? Enhancement of AI surveillance testing in human poultry population innovations and what is that AI surveillance? Is it some machine they have right now that you walk into a store or somewhere, a testing facility, you go through like a little screening machine, like a metal detector, and this thing tells you if you're infected that day. If you're infected, you come with me, please. If you're not, go on about your day. That's something that I would have a big question on. Again, analysis of viral strains, molecular biology, evolutionary patterns. How much of this is going to keep evolving and spreading, and when is it all going to come to an end? Is this something that lasts forever and we're going to just have to live with as a society? Because if this is the case, there's no president or somebody getting elected in any country that's going to do anything to mitigate or stop something like this from continually being pushed on the people. I don't care who you think it is and how much faith you have in the person. Because I'm talking to a lot of people that are placing a lot of faith in man and a lot of faith in 80-year-old men to run this country and make a turnaround when it ain't happening. So here's the answer they show on page 10. Look forward to seeing you, they say, and they're showing somebody getting a thing in their arm. That's the answer. That seems to be the answer for everything, and that seems to be where if you follow the dollars and the money, that seems to be where everything ends up. And so all of these various groups and organizations and global players, national players, local players, if we could just follow those dollars and how they're going to end up, I think it'll tell us a lot if we could follow the money. So let me know what you think, guys. This is a Bird Flu Summit, their syllabus for the course or for the conference. And there you have it. Let me know if you have any questions or comments. Anthony, signing off. Take care. Stay ready.